Good morning, everybody. Welcome to ACAP Hall County. I'm Elaine Harkins, one of the chapter coordinators. This is Amy Allen. She will be speaking with you guys today on coordination of care across multiple medical providers. Just a couple housekeeping things. There is water and coffee in the back. And if you need to use the restroom, they're located outside of this door to the left. And just a reminder, this program will be recorded.
Good morning, everyone. Thank you, Elaine. As Elaine said, my name is Amy Allen. I am the Health Programs Director here at Legacy Link, and I oversee our elderly and disabled waiver programs known as CCSP and SOURCE. And today we're going to talk about the coordination of care across multiple medical providers, and we are going to talk about creating a seamless patient-centered experience. So we want to start off with discussing our mission here at Legacy Link, and it is to support and advocate for aging adults and individuals with disabilities to be their link to a better life. And the learning objectives for today's presentation is for us to be able to define care coordination and its importance for older adults, to recognize common barriers to coordinated care, describe the roles of healthcare providers, patients, and caregivers, to identify strategies that improve communication and continuity of care, and to apply best practices to support positive patient outcomes. So we're going to start off talking about why care coordination matters. Care coordination matters because older adults often have multiple chronic medical conditions. They often have numerous medications, they have several healthcare providers, and oftentimes they have frequent transitions between care settings. And so what that means is that oftentimes they'll go from home to hospital to swing bed to rehab to nursing home. And if we do not coordinate the care, then that cycle will continue. So without care coordination, care becomes fragmenting, increasing these risks of medication errors, duplicate testing, conflicting treatment plans, hospital readmissions, and patient and caregiver frustration. And so as healthcare becomes more complex, coordination becomes essential. So what are some of the challenges facing older adults? Common barriers include polypharmacy, which means going to multiple pharmacies. Oftentimes you'll have one pharmacy that participates in a specific drug plan, maybe like the $4 prescriptions, and then you have one pharmacy that may only take a discount card or something like that. So oftentimes they're going to multiple pharmacies to obtain their medications. Oftentimes they have cognitive impairments. There are transportation limitations. They have limited health literacy, which is so important while we have a medical advocate to be able to assist them with any of their appointments that they may have to understand some of that jargon that the doctor may speak with them in. There's financial concerns, social isolation, and poor communication among providers. These barriers can negatively affect health incomes and the quality of their life. So what is coordinated care? Well, care coordination is the deliberate organization of patient care activities among all members of the healthcare team. There are several goals of coordinated care, and that is to improve the outcomes, to reduce duplication, to enhance patient satisfaction, improve safety, and ensure the continuity of care. And so patient-centered care is keeping the patient at the center. And it means that we want to make sure that we do everything in our power to respect patient preferences. We want to make sure that you are respecting their autonomy as long as they are not at risk of harming themselves or others. You want to allow them the opportunity to guide their care plan. You want to make sure that you are supporting informed decision making, involve family and caregivers, focus on their quality of life, and align care with patient goals. The patient should be at the center of every care decision. Now, the centralized care plan is a foundation of successful care coordination. The care plan should include diagnosis and treatment goals, medication list, provider contacts, referral status, follow-up appointments, advance directives, social and support needs. Now, I don't know about y'all, but I have never seen my care plan from my physician. But it wasn't until I was preparing to get this PowerPoint together that I did see a care plan, and it was on my daughter. And she had went to the gastrologist. You know how they follow up with your aftercare results or whatever. My message was, it started out with, her name at top, and then it said your personalized care plan. And I was like, oh wow, this is great. Let me see what all it's saying. And it did. It went through every single one of these examples, except it didn't talk about advanced directives because she's 11. But anyway, I thought it was really neat to actually see that in operation. The centralized care plan ensures everyone is working from the same information. And so utilizing the primary care as the primary care provider as the care coordinator, the primary care is supposed to serve as the hub of the healthcare team. Okay, their responsibilities include maintaining that care plan, coordinating any referrals. I know oftentimes our healthcare plans will allow us to self-refer to specialists, but typically they will want to make sure that your primary care physician is the one making those referrals so that they can coordinate those. Reviewing specialist recommendations, monitoring the chronic conditions, following up on treatment plans, identifying gaps in care, and leading communication efforts between providers. The primary care physician provides accountability and continuity throughout the patient's healthcare journey. Closing the referral loop. Every referral should have a outcome. The process should include referral being initiated, the appointment being completed, the specialist recommendations received, the primary care physician reviewing what was accomplished during the referral, the care plan should be updated, and the patient should be informed. The multidisciplinary care team. Successful coordination requires collaboration among a plethora of providers. And as you can see here, that includes the primary care provider, specialists, nurses, pharmacists, social workers, any kind of therapist that performs physical therapy, occupational therapy, speech, mental health, home health providers, and of course, caregivers. No single provider can meet all of an older adult's needs alone. I can repeat that. No single provider can meet those older adult needs alone. Multidisciplinary communication and collaboration. Effective communication strategies include shared electronic health records. This is why there was such a huge push for the EPIC system and making sure that physicians could see hospital reports, they could see specialist reports. They want to make sure that there was a centralized area where they could get all of the information that they needed on their patient. It's also why there's a push for MyChart so that we can be involved in seeing what we need to see in regards to our health records. Secure messaging should occur between the multidisciplinary team as well as case conferences and team meetings, and there should be a standard handoff procedure, especially when there is a physician who may retire or move to another organization. There should be something in place where the patient is notified of this happening and some next steps that need to happen. And then, of course, timely documentation. When communication improves, patient outcomes improve. And so information sharing. Patients should be encouraged to authorize communications among providers and caregivers. Appropriate consent allows for sharing medical information. I don't know if you guys know this or not, but on the MyChart, when you scroll to the very bottom, there is actually a link that will allow you to share that document to whomever may need to see it. We we recognized that firsthand professionally within the elderly and disabled waiver programs when we were out doing assessments. In order for us to present those to the Department of Community Health for approval, we had to obtain medical records for initial assessments. And so we were actually educated on that option within the MyChart for sharing medical records. Also, appropriate consent allows coordination among providers, family involvement when desired, and better care transitions. Information should move seamlessly across the care continuum. Medication management and the role of a single pharmacy. Older adults often receive medication from multiple providers. And so using one pharmacy helps to identify drug interactions, prevent duplicate medications, improve medication reconciliation, enhance medication adherence, and improve communications among providers. The pharmacist becomes a very vulnerable part of the care team. Engaging patients and caregivers. Patients and caregivers are partners in their care. They should all understand the diagnosis, understand the treatment plans and how that affects the patient, maintain medication lists, report concerns promptly to either the PCP or the specialist or the home health provider, whoever is providing the care, participate in goal setting, and help monitor symptoms. Care plans are most successful when patients and caregivers understand and support them. Shared decision making. Shared decision making involves explaining treatment options, discussing benefits and risk, considering patient values, and incorporating caregiver perspectives. The best treatment plan is one that aligns with the patient's goals and preferences. The care transitions for high-risk moments. Transitions often occur between the hospital and home, hospital and rehabilitation, rehabilitation home, and home and assisted living. Poorly managed transitions increase the risk of complication and readmission, which is what that cycle that we talked about in the beginning of the presentation. Implementing care transition protocols. So this is primarily like when someone's in a hospital pending discharge. So before that transition back home, there should be discussion about medication and reconciling all of that medication. There should be an individual involved in discharge planning and making sure that the patient understands what's going on, providing that education to them, and the scheduling of follow-up appointments. And then during the transition, that is when the documentation is completed and it is sent to the primary care physician or the specialist overseeing the patient, provider communication, and caregiver involvement. And then after transition, typically there will be someone from a physician's office who will call that individual with a follow-up. They'll schedule that primary care physician visit within 7 to 14 days and then continue monitoring the symptoms and the adherence to the protocol that was established in the hospital. There are also social determinants of health and when medical care is not alone. So it's important to include housing, transportation, nutrition, financial resources, and social support whenever we're coordinating care. Healthcare teams should identify barriers and connect patients with community resources. Examples of social support interventions are, of course, housing, home safety assessments, and fall prevention modifications. Physical therapists can go out or occupational therapists can go out and evaluate these things for individuals. Transportation, there are oftentimes your senior centers will provide transportation services. There are also community ride programs. In Hall County, we have the WeGo that will transport. I know a lot of times this is a huge issue in a lot of the more rural counties because transportation is not there. Sometimes if, like within the waiver, the personal support aides can transport clients if they need to within a certain mile radius. So there are some options out there for transportation. Of course, nutrition is with meal delivery services like home delivered meals, and if available, a nutritional counselor through their insurance program. And then social supports like adult day help programs, senior centers, or caregiver support groups. And so addressing these needs improves the overall health outcomes. Follow-up and maintenance strategies. Coordination is an ongoing process, and so it's recommended that you review your care plans at all times, maybe the information that you do have access to in my chart. Review the routine medications, review the chronic diseases and any of the monitoring that goes along with that. Preventative care reminders, caregiver check-ins, and that ongoing patient education from the primary care physician or the specialist. Okay, we are going to look at a case study right now and try to apply some of the information that we just talked about in regards to Miss Johnson. Okay, Miss Johnson is 88 years old, and she has congestive heart failure, diabetes, arthritis, a mild cognitive impairment. She's on 12 medications. She has recently had a hospitalization. And so the question would be, what coordination challenges do you identify?
Cognitive impairment.
Okay. How could that affect her?
Be able to remember to take her medications correctly.
Mm-hmm.
From a pharmacy.
Mm-hmm.
Just managing her home setting.
Mm-hmm.
Along with her 12 different medications.
Yes, absolutely. Anybody else? Okay, so I took some notes in regards to this when I was looking at it. So, like you said, many medications. There are 12 medications. She does have a mild cognitive impairment, and we don't know if, what actually that entails, but there could be confusion at when she should take the medication, when the medication's due. I don't know if everybody's aware, but a lot of times pharmacies will bubble pack medications. They can even color code them, especially if they take them 3 times a day. They could have the morning be yellow in a yellow bubble pack, the middle of the day blue, and at night could be a black bubble pack. She's also got multiple chronic medical conditions with the congestive heart failure, the diabetes, and the arthritis, and they have to be monitored most of the time by a different specialist. So she's seeing multiple doctors, probably seeing a cardiologist for the heart failure, an endocrinologist for the diabetes, and probably a rheumatologist maybe for the arthritis. Not only is she doing that, but each one of those, well, especially the top 2, require ongoing monitoring. So the congestive heart failure, she's going to have to monitor her weight every day. She'll have to get up on the scale and probably keep a log to determine if she's plus or minus 3 to 5 pounds every day, and then report that to her physician. Also, the diabetes has to be monitored. She's 88 years old with diabetes. She's probably got some decreased eyesight. So she may have a hard time even if she's on insulin, drawing up insulin, or looking at the medication bottles to see whether or not she is taking the medications when she should. Also, she has arthritis. So we don't know what kind. We don't know if that's in her back. We don't know if it's rheumatoid arthritis in her hands. So she may have a hard time just actually grasping bottles and opening them. Let's see. So she just had a recent hospitalization, so there is a potential for readmission. We don't know if she lives alone. We don't know if she has family or if she has any kind of social support. So she may have a hard time understanding the discharge paperwork as well because of the mild cognitive impairment and the fact that if she doesn't have a medical advocate, then she may not have that explained to her in terms that she can understand. So there's a lot going on with Miss Johnson that you can tell for sure she needs that care coordination. Okay, here are just some applying the care coordination model that we spoke about. So for Ms. Johnson, her primary care physician would need to maintain her centralized care plan. The pharmacist would need to conduct that medication review. And of course, if she was unable to take the medications as needed, then they could speak about bubble packing or some type of assistance for her. They actually have reminder phones too that people can tap into that can tell individuals that it's time to take your medicine. So those are things that a pharmacist might suggest in regards to that. Then the specialist would need to communicate any kind of recommendations there, and then she could have a home health nurse that could monitor her symptoms. A caregiver could support daily management, and then a social worker would need to address transportation and any other of those social needs that she would have. And so the outcomes of effective coordination, potential outcomes include reduced hospitalizations, fewer medication errors, improved adherence, better chronic disease control, increased patient satisfaction, reduce caregiver burnout, and lower healthcare costs. And so here are the best practices for care coordination. Of course, having that centralized care plan that the primary care physician becomes the hub of. That's PCP-led coordination, referral tracking, single pharmacy medication management to get that pharmacist involved, multidisciplinary communication between all of the providers that are providing services for the client, patient consent for information sharing, patient and caregiver engagement, knowing about the disease, how it affects the disease, supporting the patient through the disease, care transition protocols, attention to the social determinants of health, like the falls risk or anything going on in the home, transportation issues, nutrition, those things, and then ongoing follow-up maintenance. And so here are the key takeaways of our presentation today is effective care coordination requires collaboration, for sure, among the entire group of individuals. Communication, effective communication, discussing all the needs of the client. Accountability and patient-centered planning. So if I could leave with anything, it would be with this last statement. So when providers, patients, and caregivers work together, older adults experience safer, more effective, and more satisfying care. Are there any questions or any discussion?